I think we need to have conversations in every community in the state of Minnesota and every community in the country about health care and about health. I don't think people realize what their health care is costing them. Not just costing them in money, but costing them in lost opportunity, costing them for the future.
I don't think we're going to solve the healthcare cost issue in this country or in the state until we get everyone on board that we're all responsible at every level.
It really is important that we are partnered with the community, with patients, as we're going on this journey to getting better health. And better health also means that it is health that is affordable, because health care, if it's not affordable, it's not accessible, it's not available.
I would argue that everything that's going on in healthcare right now, with particular focus on healthcare reform, talks about new ways of delivering care, talks about new ways of organizing the folks who help deliver that care, are really a response to society asking us to solve that problem. Now, they're asking us to solve that problem, but conversations like this acknowledge that we're solving that problem together.
It's very important for me to see that we are not only a need, a problem to solve, but a partner to work with in solving the issues, the huge issues we have.
These conversations are so vital because we as providers, oftentimes we're on a track, and many times we believe that it is the right direction and that we're doing the right interventions. But if we lose the perspective from the community, from the consumers, we can be off course. And then being able to make sure that there are dollars that we normally would be spending for expensive health care, that those dollars then go into education, that those dollars go into economic development, because those are the kinds of things that are important to the health of a community.
The solutions are really going to come when the people that are actually accessing care and using health care are more knowledgeable, that they understand that their behaviors are impacting their own cost.
And I've been trying to work across cultures also, and I see the treasure we have. The communities are ready to invest time in solve the problems we have.
I think that people are very interested in their health, and as people have the conversations about health care, they will begin to connect the dots between things like nutrition, things like community gardens, what it means to have good food in the schools for kids, things like childhood obesity, adult onset diabetes, all of those sorts of things. I think as we have those conversations in communities, people will begin to connect the dots.
We are at a point in time when I think legitimately our children and our grandchildren in years to come will be able to ask us why we didn't act or thank us for having acted.